Hello, everyone. Good evening. We'll be starting in the next 2 to 3 minutes. We'll just wait for people to join in. Can anyone confirm if they can hear me? Hello, if someone can just put in the chat if you can hear. All right, thank you, Malaika. So I'll just wait for 2 minutes, then we'll kick off. Hello, everyone. Good evening. I hope the others will join us as we're going on. I'm Kende Olorade. I'm a radiology ST1 trainee in the Northwest Deanery. And today we're here to discuss the Radiology Training Application 2025. This event is directed to those who would currently be preparing towards applying for radiology training towards resuming next year, August 2025. With us is Dr. Emeka Igwe. Has kindly agreed to share his experience towards getting a training spot this year. As most people on this call we know, applying for training is getting a little bit more tricky as time goes on. It's there are more hurdles to cross through. There are more barriers to jump through, and we believe that it will be helpful to have a conversation where we share our experience. Dr. Emeka Igwe is an incoming ST1 registrar, will be resuming in the East Midlands, and is kindly agreed to prepare this, make this presentation and share with us. The structure of today's program will be it'll give the presentation. If you have any question as it goes on with this presentation, please put it in the chat box. Would make space for questions at the end of the presentation. So Dr. Igwe, if you can go ahead.
Yes, Kende, thank you very much. And thank you, everyone. And welcome to the Radiology Training Application Tips for 2025 application year. I hope I'm quite audible enough. If I am not, please do well to just let me know in the chat box. I'll be, casting an eye there as well. So we will just quickly go to the outline of what we have to discuss today. So we would start with introduction of what radiology is briefly, and then we'll talk about competition ratios, application stages. We'll talk about recruitment timelines and selection criteria. And then we'll try and spend more time on the MSRA and then also portfolio tips. And then I'll just briefly talk about the interview. But I think the main focus of this seminar today will be to talk more on mainly the portfolio, but it would be a great opportunity to talk about the MSRA because that's the rate limited step to the application process and getting a training number. So first off, radiology is a very, very interesting specialty. based on the definition by Royal College of Radiology, is a hospital-based medical specialty using imaging to diagnose, treat, and then also monitor various diseases. So radiology is a very wide specialty. It's evolving specialty. There's a lot more yet to be discovered from through this department. Application is done on Oriel. For those who are not aware already, the website I'll put on there. And getting into training in radiology has gone really competitive very recently. So I'll just go straight to the competition ratio and what it's been like. So down from 2018, competition ratio was just about 3.4%. And now we have, 3.4. And with over time, that has continued to grow, and lots of people are getting interested in radiology. In 2024 application year, we had over 4,000 people. We don't know the exact numbers yet. Usually, it's usually published or sent out to candidates or applicants, but we know from an email that it was over 4,000 people. And the number of posts for 2024 was a bit reduced, I think because of mainly funding, I believe. So competition ratio has risen to 12.9. So it's quite competitive. And there are stages to the application. So first off is to build your portfolio. And then whilst you're building your portfolio, at the same time, you have to start getting prepared for the MSRA, which is the rate limiting step for getting into this training. I think the MSRA is a main deciding factor that determines if you get invited for interview or not, because otherwise your portfolio becomes null and void, and then the ranking will come after the interviews. So we'll go straight to the timeline. So usually application opens up, it was usually in November, but I think last year opened up a bit earlier in October and then closed up before the end of November. And then the invitation for the exam, MSRA, came in December. And then the exams was done the first 2 weeks of January, and the results were out usually after 4 weeks. And with the results, then the department decides what the cutoff will be based on the number of applicants, based on the competition ratio, and also based on the available posts for that particular year. And then the offers usually are being rolled out towards the end of March. So the selection criteria, this has changed quite a bit over the years. So it keeps changing. But for last year, the MSRA was cut down to 20%. I remember there was a year MSRA was weighted up to 40%. Then the portfolio fairly has remained at 30%, 33%. And the interview has been between the range of 20, 30, 33%. But last year was, put up to 50%. So that means the interview now has got more weight, and I believe that this year, 2025 application year, I think it will remain the same in my own opinion. But these things can change as well. So we go next to talk about the MSRA. So the MSRA is a rate limiting step. I keep saying this because over time I've seen a lot of people who had to give up their dreams of being radiologists just because they couldn't, get through this exam. So MSRA is multi-specialty recruitment assessment exam. So it is a computer-based exam which several specialties make use of. but we want to focus on radiology. So the cutoff has been, changing over the years, and it's been actually been going up in the past few years. So the exam consists of two parts: the professional dilemma part, which you usually have 50 questions. 8 questions with pilot questions. You're not scored for the 8 questions. 42 questions are the ones that are the candidates are scored for, and then that takes about 95 minutes. And then the clinical problem solving part is the second part of the exam, and it has 97 questions. 11 are pilot, 86 are scored, and it's just about 75 minutes to finish the exam. So looking at the cutoff over the years, I tried to, find out the cutoff. So for 2019, 2020, I know a colleague who's, said, the cutoff then was 475. And for 2020, 2021, so that, went up to 525. And then in 2021, 2022, still about the same cutoff score. 2022, 2023, that went up to 543. Although over time, people still keep getting offers, maybe because people drop out and choose other specialties or for other reasons. And then for 2024 application year, the initial cutoff score was 555. But we know, I know eventually someone with a score of 553 got an offer. So it's quite a very competitive exam, and one needs to do really well to get the top marks. So we'll go into the exam proper. What are we expected, and how do we get ourselves prepared for the MSRA? So my own personal experience, and from what I've done over time, I've realized that I think it depends on one's clinical knowledge, but this is just an overview of what I believe any person who really wants to hit the higher marks should do. So I would say the clinical problem solving part is mainly focused on 5 domains. So they're going to ask questions on investigations, questions on diagnosis. So for instance, they give a clinical scenario, present symptoms and signs, and they want a diagnosis. Then also they want to talk about, so they're going to ask questions on emergency cases. So we have to read up emergencies and get to know them really well. Then prescribing, which is pharmacology, is also very important. And prescribing, they will mainly talk about side effects of medications and some other prescribing questions, which you will find from the question banks. And then also management, also non-prescribing management part as well. So this information I got from the MSRA blueprint, which was released, I think the last time it was released was in 2022. Then in terms of the question banks, this is just a non-disclaimer. I've not been paid by anyone to advertise any particular question bank, but from my own experience, so I think past medicine is very good because it helps you build your background knowledge of medicine to understand exactly what this exam is all about. So past medicine has got loads of explanations when you go through it. The MCQ bank is the next one. MCQ bank is also very good. I found it very useful. MCQ bank also is MSRA directed, I would say. Then the other ones, I know people have used past tests and they've made some confessions that past test is really very good as well. I know eMedica is another one people have talked about. But overall, I think I've used all of them. I use all of them, but I found past medicine and MCQ Bank more useful. That's my own personal opinion. And then another important thing is another important part of the preparation is the NICE CKS. So NICE CKS is a guideline that the exam uses to make decisions on what was the right answer to the questions. So NICE guideline is very important, particularly if you go on the NICE CKS. NICE CKS summarizes most of the clinical topics. So it just goes straight to symptoms, signs, investigation findings, and the management, what you would do, the red flags, and so many things are there. I believe most of the questions have come from the NICE CKS. So if you hold on to your NICE CKS very well, you would be, I think you do really well in your clinical exam. Most of the questions I found from past medicine and MCQ Bank, most of the answers that were provided in these question banks have been a bit outdated, I would say. So not most of them, I say some of them have been a bit outdated. So I'd say use NICE CKS as your guide as to what medication is used to treat what and what sort of management plan in terms of referral, when to refer and when not to refer, when to treat and when not to treat. So for the clinical exam, let's go down to this box. For the clinical exam, there are 12 clinical topic areas that are being assessed in the exam. And so they all weigh the same based on how they've been categorized. So the questions have come from these parts, and then so this helps us to know what areas we need to read more, what areas we need to consolidate on more. So for instance, spending a bit more time understanding cardiology will be very useful rather than spending a lot of time on ENT, for example, because ENT together with ophthalmology, together with dermatology, they weigh the same as much questions as you will get from cardiovascular. So I'll jump then to the professional dilemma part of the exam, which I believe this is the part where people really struggle with. So this is the part that has caused a lot of trouble for particularly most IMGs. So from my research, I would say the SJT is a very important part that we need to spend time preparing for. So first off, it covers 3 core domains, which are professional integrity, coping with pressure, then empathy and sensitivity. And then the materials which I have found useful, I've done research, I've asked questions, I've been in a couple of places. I've been on Reddit, I've been in the UK RST group. I've been on other radiology groups as well, and I've spoken to radiology registrars who have really scored really high in the exam. So this is what I've gathered as the best materials to prepare with. I'd say most people would say don't practice with SJT materials from the question banks. Use the question banks strictly for the clinical part of the exam, and then for the SJT part, in this order are the important materials to use. 1, the UK Foundation Program papers, very, very important. So it will be good to go through that and understand the rationale for the choice which has been used. And then also in terms of the ranking part, it will also help you to understand why a particular option was ranked higher than the other. So understand the rationale, very, very important. If you can spend more time here, that would be very good. You can go these materials over and over again as many times as you can the rationale is really important. And then, so the Oxford Access and Progress SJT is another good one. So the same thing, if you've got time, spend a lot of time practicing, then read the GMC Good Medical Practice. It'll be good to read all the sections, understand what the GMC wants, because all the answers and all the choices were based on the GMC Good Medical Practice. Then there's GMC Medical Practice in Action. If you just Google GMP in Action, you'll see it come up. So there are different scenarios that the GMC had already, put up in their website, which will help you with the SJT scenarios. So do well to go through them. There are so many scenarios that have been put there and how to respond, what's best and what's not best. Then finally, there's a YouTube channel, SJT caused by IMG Marvels. So what they've done is the IMG Marvels, what they did was, so they dissected the UKFPO papers. So they went back to number one material, UKFPO papers. So they dissected the materials. I think they used the materials to, explain, the rationales and, the tips and how to know what's best and what's not the best. In terms of the second part of the SJT, how to know which three options are the best put together. So down to the box. So this box is very, very important. I would say of every preparation in the SJT, this box is the most important thing. So most people don't understand this particular box I put up here. So this box, like I've got it from the MSRA blueprint as well. I think a couple of people, including myself, have made some mistakes in the past with preparing for MSRA, not sticking to these rules. So the first one on the ranking part, which is the first part of the AJT. So that part I've got 5 options, and they actually score more. What you have to choose here is the most appropriate single action that will solve all the problems that have been presented in the question. So on the STEM question, you have to choose which of these options would solve all this. And then once you've chosen, let's say B is the best for you. Once you've chosen B, throw the B away from your head. Now, assume you are presented with the question again, and then choose which other option would be the best that would solve the problem as much as possible, if not completely. Then you do C, for example. If C is your next one, then forget about C, think about D or E or A. So you have to see each of the options in isolation. You have to look at them as a standalone rather than chronology. So the thing is, even with this, it is still very difficult in the exam to resist the temptation of doing chronology. But if you can, do not do chronology on this part. Just choose the single best one that will solve the problem completely, partially, or not at all. Or the one that will cause problem should go really down on your list. Then, having said that, on the second part of the SJT, which is the part where you have to choose 3 options. So these 3 options are 3 options that, when put together, would solve the problem completely or partially. But it's more of completely because they try to put options that will solve the problem completely. So these 3 options will have to work together. So sometimes it can be tough to decide what 3 options are best put together. Sometimes even the ones you think are the best, 3 options put together may not be the best. So that, which is why it is very, very important to do loads of preparations with these materials, which we've listed up there. And then so it will help you to choose which 3 options put together. And the funny thing with this second part is that, unlike the first part, in the second part, if you miss one option, you lose the mark completely. You gain nothing if you lose any of the options. But part 1 is a ranking one. Sorry, the first one, ranking one. in this one, there's still a chance that you could score some marks. So I would say this particular box is really important. You can find this on the MSRA blueprint. I've got a copy. I can send them off, or we can upload them on the website for people to, have a look. So it's available for everyone to just read through. It's very important to read through the blueprint. So if you stick to these rules, this is what I think helped my score to really go up. So we'll move on to the next one because of time. So I'd say in terms of preparation, all these are other factors to consider. In terms of preparation, I'd say 3 to 6 months, because it is really getting more competitive as the years go by. So I'd say 3 to 6 months at the minimum, depending on your situation. If you have kids, if you've got family commitments, you need 6 months at least. 6 months at least. You need to start very early to start preparing. Just start reading as much as you can. If you have any free time, just try and read. Just try and gain more knowledge. Understand the exams, and then you just, particularly with the clinical part, you need a wide range of knowledge, of clinical knowledge. I found it helpful to read examination preparation experiences from other people who've scored high. I've mentioned that earlier. I spoke to registrars, people who've done well. I tried to get permission from the groups, and I contact people privately to ask about what they've done differently. And also for the SJT part, the other thing that helped me was I discussed every challenging SJT question I met with the F2s, or with the SHOs who are trained in the UK. So because they have a bit of a different way where they look at these things, which I didn't. So it made me understand better how the system wanted us to react, or how the GMC wanted us to react to particular situations. So identify your weak points, and then consolidate on them, study more, and you could get more information from Reddit as well. And then I found I became quite religious, because I tried the exam a couple of times and I couldn't get in. So I think I did lots of prayers. And for those of us who are very religious, whatever works for you, just stick to it. I had to add it there because it was part of my story as well. And then so we'll go on to the next slide. So we'll talk about portfolio. Portfolio is the next part we need to discuss. So for portfolio, so I'd say you need time. Time is really required for portfolio. So starting early is very important. But I would say it would be best to work with the portfolio requirements for 2024, because that was changed in 2022/2023 application year, and not much was changed after then, and it still remained the same till now. So I'd say it will still be the same portfolio assessment requirements that will be used. So then you could do your assessment yourself, see how much you've gathered. But I would say, if you've done the basic things in your portfolio, I'd say, don't, worry too much about it. But I think there's still time to do more on portfolio right now. So we have just about a couple of months left to the MSRA exam, and to when the application will start and close. So yeah, so I'll go into details on what tips that can be used to build a very good portfolio. So on the next slide, we'll start to talk about. So I'm going to use the 2024 self-assessment guidance. So to discuss. So domain 1, commitment to specialty. So I think this is a very important domain. It will be very difficult to convince a radiology consultant who's an interviewer that you want to do radiology and you've not done a test a week, or you've not had any experience or exposure in radiology department. So I said to get the top marks here, and also to save time. So what I did was I had a tester week done already. Minimum number of days will be 3 days minimum. But it would be good to just have a complete, 1 week tester week for this, just in case if you're being asked, about your tester week and your tester sessions. So the other thing I did was, because I remember I had I did a radiology rotation back in medical school. So I just contacted my medical school in my home country, and I was lucky to have the current dean of medicine, write me a letter saying, covering that I've actually done the rotation. So that was how I covered this area. So I didn't have to do 2 tester weeks. I just did 1 tester week, and I used radiology experience as a medical student. The rotation was just about 2 weeks, which is acceptable. So that's for that part. But if you have the chance to do 2 tester weeks, that's absolutely fine. But just try to make sure that the first tester week, you've got lots of difference from what you did in your first one compared to what you did in your second one, which is part of what they wanted here. And also, I think if you've been in any sort of radiology research, that also covers as a radiology significant exposure in addition to a tester week. So the second domain will be leadership and management. So for leadership and management, it was quite a tough one for me. So I couldn't. I've not had any national role to do with radiology. So scoring the highest point there was quite a challenging one. But I've been involved in a lot of leadership roles that had involved medicine, not particularly radiology. So what I did was I had to get one of the certificates, which I played a role in a medical foundation. So that was accepted as well. So I think, if there's anything we can do here, if we can try and get, score 5 on this one, that'll be very good, I would say. But if anyone has already had a national role or national leadership role in radiology, then that's awesome. That's perfect. And that scores the highest point, 7. But otherwise, just aim for 5, I'd say. There are a couple of things that can be done. So first off, I know a couple of people have used working as a mess president, or getting involved in sort of like maybe just writing to the what's it called again, the ALS team, and see if they can participate. So if you've done ALS before, you could write to Resource UK and see if you could participate in being one of the people who would chair the ALS, and then maybe just participate somehow. So I think it's achievable. There's still time left. There's a couple of things that can be done as well. So for the domain 3, teaching and training. So for this particular domain, so I was able to score the top mark, which is 5. So I organized a national teaching program back in my home country. So I had a couple of people who were interested in doing teaching. So I just joined, and then we organized national teaching program. So which I got a certificate, and then that was what I used, and it was accepted. So it mustn't be based in the UK. So if you have an opportunity to, just get to your home country, or maybe contact any recognized organization, and then see if you can be part of what they do, There's a lot going on out there on a yearly basis or monthly basis. You can actually see if there's something that you can participate in, and then aim for the top score here. Otherwise, the next would be to aim for a score of 4, which is not too bad as well. It's just it will be a good attempt, I'll say. So, but I'll say if you can do the 5 one, that would be very good, because even 1 mark on the portfolio made a huge difference in this year's application and the ranking. So 1 mark is very important. Just 1 mark is really, really important. It can make a lot of changes to, where you rank and what offer you get, or if you even get if you even get an offer at all. So go to the domain 4. So domain 4, which is formal teaching qualification. Oh yeah, this one was really hard. There was nothing I could do to get the top mark. So what I did was I couldn't do the PG SAT. I had an opportunity to do PG SAT, but I couldn't do the PG SAT. So it was quite expensive to do. I think PG SAT takes about 6 months, and it was quite expensive. I couldn't do it, so I just did the teachers training course, which was 2 days, and I scored 2 there. So, but this part is quite difficult, I'd say. So, which is why we have to aim for the top marks on the other domains. So, domain 5 now, audit and quality improvement. So, this one, I think everyone should aim to score 7. So, for this part, you just need to, do 2 audits. Okay, 2 audits. So the audits, they mustn't be quality improvement in the sense of they mustn't be you mustn't re-audit them, or if you can re-audit them, that would be the best way to show that it had a change in practice. But I know people who've done just an audit on a topic. They did an audit on a topic, and what they did was to try and discuss with the department that is involved, and then get the consultant to say yes, that based on the audit and the findings and the discussions that we had with in the MDT or with the team, that it made a change to the way people started to see things, and it made a change to how people approached that particular problem. But in my own situation, I did 2 QIPs, and that was accepted. Another tip I'll give here is sometimes when you go to the consultant to request for to be involved in an audit in radiology, there are some audits which had been done already in radiology department, and they were abandoned. They hadn't been re-audited, so, and no one had picked that up. So if you go to the audit department in your different hospitals, they will be able to help you find audits that have been done in radiology that had not been re-audited. So if you re-audit those ones, you will be certified with a QIP certificate, and you can present that as 1. And if you're lucky enough to have another one which had not been re-audited, you can re-audit that, and that could be another one you can use to get the top score here. So this is one of the tips I think I used one of my audits was just a QIP. So the first one was when I wasn't even in the hospital. So I just came into the hospital, spoke to the consultant, and I was lucky to have one audit that was already done but has not been re-audited. So I just re-audited the audit, and I showed that there was a change in practice, and it was accepted. So that's for that one. So those are the few tips I can give there. Then domain 6 is, so I'll say for domain 5, aim for the top. Just aim for the top one. Don't leave room for going down or losing scores on domain 5. So domain 6, Yeah, so this one is quite a tough one as well. So I couldn't hit the top mark there. I've got no postgraduate degree in research, so but if you have, brilliant, excellent. So what I went for was the second point, which is I scored 4 there. So I've got case reports from radiology consultants, and I wrote them up and then I got them published. So I think we should try and see if we can get to number 4 at the least. It's doable. It's just one peer-reviewed publication as first author. So if you can try and do one as first author, that'll be very good. I think that's the only thing you can do there to get to aim for 4 marks there. So that's doable. Well, otherwise 3 is still not bad. But I would aim for 5 and 4. 5 is a bit tough, but 4 should be okay. I'll say 4 is doable. So it's not too late now. You could just get a radiology case report or an interesting case. Speak to the consultants. They're very, very happy to help. Because the thing is, the consultants, they also need this, they need the case report published because it helps their own appraisals as well. So they'll be very happy to, find something for you to do, and then, they can be, listed as the authors as well. So number 7, I think that's the last domain. So prize and awards. So for prize and awards, I'd say for the first one, I tried to aim the first one. I was lucky. So the first one was, so what I used was a decision award in final year primary medical qualification. So so in this part, I think what will score you top marks is not a distinction in a course. So for instance, if you had a distinction in pharmacology alone, so that wasn't scored as a top mark. So what this means is, in the final MBBS, when you've graduated, so there's usually an award has been given to maybe the best graduating medical students, or the best 5 graduating medical students, or the best 10 graduating medical students. So I think that was what I used here to score top marks. But otherwise, if you can, do any interesting, have an interesting thing done in radiology that could, get you a prize awarded at a national level, that will still score you top marks there. So I think a lot of people went to Radcast. Radcast had a disclaimer as well. I've not been asked by Radcast to advertise anything, but I know Radcast had something which they organized, and they tried to help people to, get top marks on this particular section. But otherwise, if the top mark is not achievable, the problem here is the next mark is 3, which is sort of like half of the top mark, and that's a lot of score to lose, a lot of marks to lose there. But otherwise, prize that is awarded at a regional level is also an option to consider. But I think if we can aim to score top marks there, that'd be very, very good. So the reason is because the portfolio part, scores 30%, and that could be your lifesaver as well. So that could be your lifesaver. So I'll go to the next slide. So in terms of portfolio, more tips. So these are the things that we need to be aware of. So all achievements, according to the rules that were put up on the website, so all achievements should be dated after commencement of your first relevant undergraduate degree. So let's say you've got 2 degrees. It's got to be after your first undergraduate degree, or in any case within the last 10 years. Well, I would say most people have got, their portfolio recently, so this may not really apply to so many people. Now, the scores are non-summative. So what it means is, if you have, let's say, you've done a teaching program in a local setting, let's say in your department, and then you've also done sort of like a regional teaching. So those score you separate marks. So the regional teaching is one will score you the highest score, but you cannot combine both of them. So both cannot be combined as so just to help you to get the top score. So that's what this essentially means. I think that's quite self-explanatory. So you have to choose which of your achievements will give you the highest mark for that particular domain. So an achievement may legitimately fit under multiple domains. Yeah. So I will give an example. So if you, for instance, so I know people who've done audits, very interesting audits, and they had it presented in their department. So they use the audit for the audit section, the audit and quality improvement section, and then they had the audit, let's say, published uh, on a peer-reviewed journal. So, and you can also use that same audit, which has been published, on the publication section and still earn high and still earn all the marks there. So it'll be a good thing to do. Be smart enough to manage your time well. If you have an interesting audit which you can present at a peer review journal, there are so many journals out there that'll be willing to look into your presentations and have them published. There are just so many of them. So you can just Google and you find so many of them. I know a couple of them, and I know so many of them actually that you can send your audits if they are quite interesting, and they can accept them and publish them. And you can use the audit for the audit and QRP session, also use it for publication session as well. So then the last but not the least tip is only completed achievements at the time of submission. So at the time you're submitting your application, so whatever scores you want to score yourself on the application form on Oreo, you have to make sure that all your achievements have been achieved by the time you submit. So so they won't score you for achievements which that have been dated after the the close of application period. So there's an achievement which was dated in December, and application closed in November, for example. So according to the rules, you won't be scored for them. So which is why we have to do to get all these sorted early on. And then the next is we'll talk about the interview. So the interview changed significantly in this particular round. So I think the interview in the previous years were just more of based on communication skills, team working, coping with pressure. So usually they will give you a clinical scenario, and then we tell you have a colleague who's struggling, just that sort of thing. But right now, it's changed a lot. So what we had was prioritization of clinical situations. So they give you a set of clinical situations and ask you to prioritize them, which is the most urgent, and then or the the emergency there, and then you just prioritize them, and why. You just give reasons why you prioritize them, and then they ask you follow-on questions on that particular set of clinical situations. And then also there's a second station as well, which basically was about communication stations and team involvement. So and then the interview now is 50%. So I think it's a very important part. But I think right now focus more on preparing for the MSRA and then getting the portfolio all sorted. Thank you everyone for your time, and thank you Kehinde for this opportunity. And I want to say I want to wish everyone well in their preparation. And yeah, if you have any questions, I'll be happy to take any questions. Thank you very much.
All right, thank you, Dr. Igwe. It's been very enlightening, sharing your experience and like things that worked for you. I think there'll be a number of people who have possibly applied for this for radiology maybe in previous years attending this program, and I think it's helpful to hear different views and the different experiences people have had. So we'll be taking questions very soon, but just so we can just give a brief introduction of what RIGAF is about. So RIGAF is an organization that sort of explores radiology as a specialty for early career doctors, radiology residents, and also for consultants all over the world. We try to support people who want to enter into training, and we try to provide access to resources in whatever country, in whatever continent, whatever network we have. We'll try to give you support you in your journey into radiology. We are basically radiology evangelists. So we believe yeah, it's an interesting specialty, and that's yeah, a number of people have the skills and have the interest, and just maybe do not know too much about it, or do not know how to access it. So before I take questions, I'll just quickly discuss, just quickly like mention one or two things to add to what Dr. Igwe has said. So for commitment to specialty, if you've not had this already, please, there's not enough time already. It's June already, and November is like 5 months away. So you want to apply for your tester sessions very early on, because the spaces get filled really fast if they're not. So if you can't find in your hospital, try to go to the radiology department, have a chat with them, and see if they can fit you in. If not, try hospitals in your deanery or your local area. Try to make it as different as possible, as Dr. Igwe has said. For leadership and management, from going through the portfolio, I know you need at least 6 months experience of the lead. So you need that now, or at least by last month, I think. That's May. You needed to have started like a leadership position at least by last month, or maybe this month, if you're lucky, to get that, especially if you're looking for something in radiology. But like Dr. Igwe said, 5 is also very achievable if you have past experiences of like being a leader in a healthcare situation. For teaching and training, like said, it's I think 4 is the least anyone that's reasonably like serious about building a portfolio should get in this. It's not so hard to organize a local program. We, as posts or like maybe even FY2 level doctors, you can organize local teaching for medical students, for basically in whatever topic you feel confident to teach, and with like a clinical supervisor, maybe a consultant or a higher level trainee supervising you. For formal teaching qualifications, 2 is the least anyone should get. Everyone should do the teacher and train. If you have had the teaching qualification, like you mentioned, kudos to you, but it's not. I think 2 is reasonable for everyone to get. For audit and quality improvement, there's the RCR website, the Audit Live. So if you're looking for topics you don't have, and so you can just go there and look for 1 or 2 audits that you find interesting and that you can do. A good way to approach this will be like your current, try to marry your current, especially say you're in the ED, try to look for audits that cover both the ED and involve radiology. If you go to RCR Audit Live, I'm sure someone will put it in the chat box. You see there are a number of audits there. My own top tip for audits is like go for the low hanging fruits. Try not to do anything except you are looking to get an audit that you need to publish. Try to go for something easy that you can complete in time. You can get your data in 1 to 2 days and do the intervention with minimal stress as possible. Maybe post the poster in the department somewhere. Try to, because if you're starting now, you want to complete anything that has to do with portfolio early enough so you can focus on your MSRA and interview prep. Yeah. For academic achievements, yeah, so your poster, you just present your poster as an audit, basically. That should give you so just present your audit as a poster rather. That should give you at least 3 in this one. If you are highly motivated, look to publish and get the 4 in this mark. It's doable, I think. But like I said, go for something easy, go for something simple. Work with people who have probably done research before. So RIGAF will be having a research club this year, looking to support people who are hoping to start research, and we'll be starting that like in the next 1 month or so. In the next 1 month, just look out for the announcement if you're on the RIGAF web page, and we'll also put this on our on our socials also. So just keep an eye out for that. So yeah, for prizes, Radcast has a anatomy competition every year, so you want to keep an eye out for that. There's some conferences that have prizes attached to them, so you want to apply and write their essays. RIGAF will be organizing a conference this year in next 3 months. We'll put the announcements out very soon, and would invite posters. Those who present high quality posters and are competitive enough will be awarded certificates of prizes. I think at least the first 3. I'm not sure. The conference lead will give us more details on that. We would also at some point you look out for conferences where they have like essay competitions, and if that's something you have strength in, you want to look to apply. Who knows, you might get in. I know the SRT, but they just completed their own conference. They usually do an annual essay competition. One thing you can do is just look for radiology conferences in the UK, radiology conferences in Europe, and see if there are any competitions attached to them, and see if you can like prepare for it. That would be helpful. So Dr. Igwe would be taking questions. I'll also be on hand to like add in my thoughts. All right. Thanks, Dr. Igwe. So someone asked, which material explains the UK Foundation program papers? I think you mentioned the SJT Marvels.
Yes. So the SJT Marvels, the one on YouTube, so they just kind of like explained, the tips there. So it's quite interesting. It'll be a very good one to go have a look at. So I think, let me just see if I can go back to the slide that where I put that up. Yeah, so if you just go on YouTube, just Google SJT Marvels, and yeah, IMG Marvels, sorry, IMG Marvels. Yeah. SJT course for IMG Marvels on YouTube. And
right.
yeah.
Yeah, so someone asked, how do you organize a national teaching program? Do you want to take that one?
No, you can take that one, and then I can add a few things.
Okay. Yeah, so I don't think it's as complex as people make it, but what you want to do is you want to make sure there's credibility with it.
Yeah.
It will be helpful to like have a clinical supervisor, especially if it's radiology related. The idea is if you're looking to radiology is sort of like a specialized sort of specialty. You're not expected to know. In fact, your first year, you're not expected to know any radiology. Basically, they're teaching you like you have no exposure to radiology. So if you're going to do any teaching that relates to radiology, you want to be sure you have like a clinical supervisor, somebody who is able to review your slides. With the national teaching program, it depends on your audience. If your audience is maybe FY2 level doctors across the country, you can collaborate with your colleagues in other trusts and try to organize a regional program, or try to organize a national program, and it's a good thing that it's online. Make sure you get feedback for all your teaching sessions. We would be getting feedback for this teaching session. We just make sure you get feedback that shows you've done organize these teaching sessions, and make sure that you deliver them across, I think, 3 to 4 months. 3 to 4 months. Make sure you get feedback for all of them. And I think, and make sure you are supervised. You have like a consultant or like a higher trainee that can say, okay, yes, I confirm this person has done this. I think that should be helpful.
Yeah, that's good.
Okay. So someone's posted a conference. I don't know about this conference. It's not like from us, but you can have a look. I think they are open for some abstract and submission, poster submission. There are a lot of conferences that you can look around. I know the IR conference, IR Juniors conference usually holds every October around October, November. So you want to look out for that. The UKIU just completed their imaging congress. You could have presented there if you like applied early enough. Yeah, I think that's on that. Does MRCP UK work as an award? I'm not aware that it does. I'm not aware that it does. The only thing I don't think it also it initially counted, but that's like 4 or 5 years ago. It's not.
So
Yeah,
MRCP has been scrapped from the portfolio.
yeah.
Yeah.
So it's not. Do you want to take the next questions? Someone asked the evidences. I think you mentioned that you got one from Olayinka. Can you see the questions?
Yeah. The evidences we need from our home country, do we also need to get them signed before submitting? Yes. So you have to get them signed by, let's say, whoever supervised the teaching. So, so for example, um, so what I did actually that was accepted was, so there was a company, so they had, so it's sort of like, the way we have, let's say, Guinness, we have Guinness, you know, so you could, if you, there's a way to reach out to Guinness in Nigeria. They've got branches all over the states, and you could organize to say, okay, you're a medical doctor, you want to do some health webinars or health sessions, like a series of health sessions, just to educate them, and maybe you could choose any interesting topic, anything that would benefit them as workers, maybe health hazards, operational hazards. It could even be on hypertension, diabetes, and then if you can get that, and then have that arranged, you could collaborate with someone else, and you guys can deliver the teaching. I think this time around they want the teaching delivered over a period of time. So you can deliver the teaching, series of teachings. It could be short sessions, maybe like 15 minutes, 20 to 30 minutes online, and they love those health sessions, so they could get their members from all over the country to sign into it, and you could get feedback from them. There could be a lot of them online, listening to you. So you could develop those, and then the manager could use, their own letterhead to say, okay, yes, they know you, you introduce yourself, you work there, you work in this hospital in the UK, and then you've delivered teachings sessions for their employers over time. And that was essentially what I used, and it passed, and I got the top score for national teaching. So it mustn't be the teaching mustn't be based on medical people or maybe F2s and stuff. So it could be a health teaching to any of the recognized companies, that could be. So that was what I used, and it
Yeah,
passed away.
that's interesting. Actually,
Yeah,
I haven't like heard that, but it's
yeah, yeah,
actually
yeah.
for it
Because
doesn't have.
when you go down to that part of the what they said is, if you've had a significant teaching program, which at the national level. So they didn't specify if it was radiology related teaching. They didn't specify what sort of teaching it would be. So it's just a teaching at the national level over at least a 6 month period.
Hmm.
Yeah. So that was what they also put up there. So there's a lot of you could just think of companies that have got, you know, big
National coverage.
national, yeah, not national coverage. Yeah, it could be in India, it could be any country. Just speak to them, deliver some health sessions, and you can use that to earn your marks. So
Yeah. Okay, go on. Sorry.
no, I'm done. Yeah, I'm done.
Yeah.
Yeah.
I think a very a good way to approach this would be to go through the self-assessment criteria,
Yeah.
score yourself, know the level, the amount of work you can, the sorry, the scope of like the improvements you can make in each domain. What is realistic? Like for example, the first domain, you can get the top marks for it. Everyone should get the top marks for it, but you need to work towards it very early enough, and you need to just realize, okay, now I'm scoring a 22. How can I get to a 30? Now I'm scoring a 30. How can I get to a 40 in the next 3 to 4 months? I think it's also very important, like Dr. Igwe has just mentioned, to use the resources you have access to. So try to go for low hanging fruits. Use the network and the resources you have access to get all of the evidence that they require. So we'll move on with the questions. So do you need to get the evidence signed before submitting the application?
Oh
No,
yes. Are you still allowing cat, or you're done with that one?
yeah, yes, okay, yeah, that one.
So just essentially, the manager of the company will just write you a letter which is signed. So the letter will just say, okay, this is a letter of appreciation, or it could be a certificate. It could just be a letter.
Yeah, I think this person is asking about like the timing. You need to have completed it before the deadline, but
Yeah.
you can the uploading is still like February, isn't it? When you upload the proof.
Yeah. So uploading is around February, but you
Yeah,
need to have had, so whatever it is you upload would have been signed, before the close date for
yeah,
the application timeline. Yeah.
yeah. So I've posted the email that you can direct any questions to. So it's in the chat box. There should be a recording session, but it will take maybe 1 to 2 weeks to process this and upload it to our sites. If I've done an elective in radiology during my FY1 equivalent in India and can provide a certificate from university that includes all the postings, will I need a separate letter from a consultant to claim marks? What do you think, Dr. Igwe? You submitted a similar.
Yeah, so the difference here is that this is an F1 rotation, but it was an elective. So I think as an elective, it will score you your marks. But the question there is, if you provide a certificate from the university that includes all the postings. So what I would say is, if there's a way to just narrow down, because you don't want the examiners or whoever is going to score your portfolio to really struggle finding what they need to score you. If there's a way to just, you know,
Highlights it, yeah.
highlight or crop out, the rotation in that certificate you've got there, just crop it out and just present just that one and remove the other things there. It will make it easier for them to just go through and then just score you. Sometimes they get bored and tired of scrolling through documents, and once they don't see what they're looking for, you don't get scores. You just move on because they have a lot of things to do. But if you can get a letter which will just specifically talk about the radiology as an elective, which rotation which you've done, that makes it much easier to just present. Anything to make it easier for them to just score you your marks.
Yeah. And in that letter, if you can get it, try to convince them to write all the parts of radiology you saw. So you can like make like Dr. Igbo was saying, just make everything as clear as possible. You don't want any questions or any query. You don't want to go through the appeal process. So just get a clearly written letter that shows, okay, you had an elective radiology, you had exposure to CT, MRI, ultrasound, whatever sessions you did. And I think that should be able to count. How does one collate this portfolio? Can it be in a Word the doc format? So there's a portfolio uploading sites. I think I don't know how it was done this year, but
So I
when
think
it was, yeah.
so it's the same as last year.
Okay.
So there's a website they'll give you a link everyone to. So those who have crossed the MSRA score, they send you the link. So on the link you just see them categorize the different domains. So for domain one, click on domain one and then attach your evidence and then name or label the evidence properly and then do the same for the rest of the domains and that's it. You don't have to put everything in one document. No, you don't have to do that.
Yeah. Yeah, I agree with that. So if one has few months of radiology training in home country, can that count as multiple exposures and would one still need to do a test a week? So it depends on how months of radiology you have. So there's a limit for ST1 application, and I think that's 18 months.
That's correct.
If you have more than 18 months, you're supposed to apply, and you want to apply into radiology training in the UK, you have to apply at the ST3 level, which is a bit more competitive, but you that's just the rules. But if it's not up to 18 months, I have heard, I know someone who applied, and when I did, who was a radiology resident, and prior to like working in the UK, and he got his full marks without having to do a test that week. But like we said, there are plenty. These things can change, and we're not like giving. They can come up with a policy tomorrow and do something that changes the whole game, or change the portfolio to be even more radiology specific. But I think I agree with you, Erika, that this is very close to the final form of this. I don't know how they can like make this worse. I'm sure they can. They can find a way to make it
Yeah,
worse.
the thing is, I'll say stick to this year, this 2024's portfolio scale because that's what everyone will focus on. So eventually, even if anything changes, you're not the only one affected. Everyone is affected. So if you're scoring top on this one, you'll still be at the top overall. So I wouldn't want to worry about any changes that will be made. I'll just
Yeah,
say stick to this one, get as much as you can from these ones, and then hope for the best. It will affect everyone if they change anything, not just you.
yeah, that's true.
Mm.
That's true. So, do you want to take this one? Is there any formal feedback form to use? Uh,
I don't think so. So
I
what I
don't,
used was Google feedback form for my teaching,
yeah,
and I used that. I submitted that with the letter I got from the manager of the company that I presented the webinars to,
mm,
and that was what scored me my marks. Yeah.
yeah. So, it's just what's the elements of a good feedback form? You want to show that people have gained from what you've taught, that there's been an improvement in knowledge. So you ask them how was it helpful, what did they like about it, what did they not like about it, how would the next session be improved for them, what else do they want to know, similar things. So you just like Google Form is free, and you can, yeah, I think you should use that. If you don't know, there's no formal feedback form that is used. I think that's just the easiest answer for that.
Yeah.
Yeah. So, what score can we get if we worked in a teaching post? Uh,
I
I
would say working in a teaching post, if you've been a teacher before and you've not got any qualification, then I don't think you'll be able to score marks. So it's about holding the qualifications. The qualifications are important. So let's say you've taught in a school before, and let's say in a secondary school or university, and they've just given you a letter to say yes that you've been teaching them their students. I'm not sure it will score you because looking at them in four, it says you have to hold a formal. Let's say the second one says formal teaching qualification. Except if you had the qualification, you've actually done a course or you've done a program and you've been deemed qualified, and then that's probably what will score you. Ken, did you have anything else to add?
know. I think you're right on the money with that. There's you have to have the certifications. The only other place is the teaching experience that can come on that. I think is that not domain 3 or so?
So
Or is it domain 5?
domain three.
Yeah. So have you just, if it falls into any of this, you can, yeah,
You can use that there.
I use that, yeah. So does organizing local weekly teaching rota for junior doctors count? I think that will count as a organize making a major contribution. Depends on if your contribution was major to a local teaching program. That should score you for at least. If one is in residency in your home country, can one use that as exposure and also teaching of younger residents? Yes, just we've answered something similar to that. If you can only apply to ST1 if you have less than 18 months experience in radiology training, and you can do so far it meets the criteria, and you have the proof that can clearly show that you gave a major contribution to a local or regional teaching program. That should um yeah. So this is a bit tricky. If I continue an audit that has been started before, will it still count as you having led the audit from the what's the name, from
And what they
the assessment?
specified, I mean, the assessment, yeah.
Yeah, you have to. It has to show that you've had improvements. So you have to show that there's been an intervention, and you
Mm.
have to have a second cycle for it to count for the full marks. So I would just recommend that you aim for that. Yeah, and yeah, there's enough time to complete two audits if you are. I believe if you are motivated and you have like a supportive department. If one has finished residency, it depends. If it's radiology residency, I don't think you qualify for the ST1. Maybe the ST3 will be a better application to aim for. So if you can look for the portfolio requirements and try to prepare towards it. I believe for that you need to get a alternative, like a CREST form, but it's a higher form of a CREST form, alternative to a higher specialty training form, and you also have to have completed your FRCR Part 1. So if you can just maybe have a look into that. What would be the ideal minimum portfolio score that will help to secure an offer in your opinion? I don't think I don't think there's an answer to that.
So I'd say for this particular year, so the total score was 45. I think the highest score I saw was 42. Someone had 42, yeah.
That's nice.
And yeah, and 42, I think the guy he ranked number one. Um so but I think the average portfolio score for this particular year was around between 25 and 32. That's the average. Most people had between 25 and 32. So 38 was top, was high, 39 was high, 42 was rare. But I believe because there's been changes recently and people hadn't had time to
Yeah,
hit these top marks. But I think this particular change has this 2025 year will be the third year if this particular assessment is used. So I think people would have had enough time
build. Yeah,
to build, yeah, to build. So I'd say it will go up. I would definitely say it will go up. So I'd say, you know, because the SJT part of the MSRA can be quite tricky.
yeah,
Scoring high in MSRA is hard now. So even if you score high, it doesn't really count so much because it's just
yeah,
20%. You see, so even if you score 600 in MSRA, which is very difficult, well, even if you aim for that, it doesn't really contribute as much as the portfolio would do for you.
yeah,
So I would say because of that, I say the portfolio now is quite important. It's you need
yeah,
to do as much as you can to get that portfolio come up a little bit.
yeah. I agree with that. I agree with that. If this question was coming closer to the application date, and I'm trying to like encourage you, I'll say the interview carries the bulk of the mark.
Yeah,
Score as high as possible in the MSRA. If you don't have time to prepare for it, now you have time to prepare for the portfolio. So try to make yourself as competitive as possible. But if you have a high MSRA and you perform excellent, because people can have the 50 over 50 in interview and you do well in the interview, you can you can squeeze in, but it's just that you might not be competitive enough. You might rank, but not so highly with those who have like high. But so now you want to give yourself the best fighting chance. Start preparing your portfolio as early as possible. All right. We would be rounding up in the next 5 to 10 minutes. We'll just take a few questions. Um, so there's no ideal minimum like we've answered, but just try to get as high as possible. No, I don't. This is not the ST3 program, but you don't have to write MSRA for ST3. No. The SGT. Dr. Igwe has talked about it in his talk. So if you can just look out for the recordings when it's available, and we would that should answer your question. Can you give us more examples of leadership and management posts that will be readily available in the NHS? It's mentioned. It's actually mentioned on the assessment criteria itself, like BMA leadership. I think they give some examples, like MES leadership. So if you've been like, I think the BMA has like national representatives that elected to go to the national meeting. So if you're one of them, that could help. Yeah. Or if you have like there's maybe a student group that you've led as a national leader, that could also help. Could I tell you more? Could we tell you more about the research? So we would release details as soon as they're available. We're trying to gather faculty and we want it to be really effective. We're not, the thing about is we're not promising that you'll be able to publish before the deadline this year. But if you're interested in publishing, if you're interested in radiology, we'll be able to provide support. If you're motivated enough and want to complete it before the deadline, that would also be that would also be great. But it depends on you basically. If I join a registrar to do an audit, can it count? Definitely.
Yes.
Just make sure you're one of the first authors if you're publishing a poster, and that you truly contribute anyway. Yeah. Did you want to say anything, Dr. Igwe?
No, I agree with you.
Yeah. I don't have an experience certificate for my radiology residency. In that case, what evidence should I use? I did residency for 16 months. I don't know. You can submit proof of getting into the training. You can submit your rota, and that shows that you completed whatever rotations you did in those 16 months. I believe that should be sufficient, but it will be helpful to get a letter from the department that can confirm that.
Yeah.
Yeah. In the academic achievement session, what else did you mention apart from Rust having a prize in anatomy? I said there are essay competitions that you can apply for in conferences. There's some conferences that do certificates for like posters, presentations, abstracts. So if you've done an interesting audit, write an abstract and submit it to just basically be like on the lookout for any prize anyway you can win. Basically, that would be helpful. So how many times on average does one take the MSRA before securing a radiology job? Dr. Emeka, do you want to?
Well, there's no set amount of time you have to write it. The thing is, if you understand the concept, and if you practice well, you should be able. I know people who've done it once. They just did the exam once and then got the training. Some people do it a couple of times. So it's all about consistency and then practicing, doing the right things, and then hope for the best.
Yeah, I agree with that. There's some people that have everything, but it's just the MSRA. Some people get into the interview is an issue, and some people get in immediately. It varies, but you just want to make sure you give yourself the best fighting chance you have. The better course of action would be build your portfolio to make it as good as possible now. Prepare for your MSRA in time. Those are things in your control now. Make sure you score as highly in the MSRA, get the portfolio done and settled. And it doesn't how do I say it? It doesn't expire. Your proof doesn't expire. You can use it at least if it's been in the last 10 years or so. you can use your proof. So you always have access to, like reusing the same. You don't have to build a new one every year. So
Yeah.
that's helpful. If you, and no one knows if like how many times, the average times to apply to get a position. It's not, there's no one that does that. So if you're a beneficiary of a national scholarship in medical school, can it, it depends on what the national membership is in medical school. But if you can prove that it was awarded in your final year, you can, I think you should be able to claim for it. Does the first author publication have to be in PubMed? I'm not sure about that, but I think it's detailed that it should be PubMed indexed. So that should be if you can get that sorted, that'll be great. But even if you don't, if you have, you can prove that you have a first author publication, just upload it anyway, since it meets the criteria. We'll be rounding off now. Before we go, okay, I'll just answer these questions. Can you join someone to do the national training program? Or does it have to? It doesn't have to be led by just you. You can like be a group of people that are delivering national teaching. So far you've played a major role in organizing and contributing to it. I think it should count. That's if they don't change it, but I don't think they will change it. So a master's degrees with research counts as a postgraduate degree with research, right? It doesn't have to be a PhD. I believe it does. It doesn't have to be a PhD. It should count, according to what they've released in the self-assessment. Dr. Igwe, is there any like last words? I know you're off the stage now, but if you can hear me, do you have like any last words to say before we close the session?
Sorry. No. I would say all the best. Just do as much as you can. So if you've done your best and you think there's not more you can do, then that's fine. Then focus on the MSRA. Then do to just prepare for the exam. The interview, you still got 50 marks there, 50%. So you can get 50% actually from the interview. So if you're able to get to the interview stage, which the MSRA is what will get you there, not the portfolio really. So if you get to the interview stage, and you're able to smash your interview, then that's it basically. So I think just do the best you can with the portfolio now that there's still a bit of time, and then prepare for your exam. The MSRA is really important.
Yeah, I think those are like. Do you want to see some? Did I cut you off? Sorry.
No, Joe. Just one last thing is, I think one of the questions, I think the person was asking, I've said I wrote it several times. So the several times there is just because MSRA is on twice every year. So, with GP application, there's around two for GP. So there's MSRA done in September, every September. There's MSRA done every January. So I try to do, both of them until I got my score. So I just keep going back, apply for GP, go back, do the exam, use it to, assess yourself and see if you're doing well or if you've improved. So that's basically it. It's not, there's no other way. There's no other way. It's just to keep practicing.
All right. Okay, so thank you everyone who has been a part of today's event. We are grateful for your audience. We've sent the feedback form to the chat. Kindly fill your feedback. If there are any questions you feel you need some answers, there you can just put a note there. We should be able to direct you. Our programs would announce our programs for the year shortly in the next 1 to 2 weeks. We're looking to do a lot focused on research. We're looking to do a lot focused on teaching also. So if you can look out for them, if there are any places that you feel you can fit in, please volunteer, participate, and if you have any questions, you can always reach us at Radiology Interest Group Africa at gmail.com. Thank you very much for your time, Dr. Igwe. We're grateful. Thank you everyone who's attended and participated. All right, so we'll be ending this now. Thank
Thank
you.
you, everyone. Yeah, thank you. Thank you, Kende.
Yeah, thanks. All right.